Group for the Advancement of Psychiatry, GAP, welcomes you to the History of Psychiatry video series. Cultural and religious views of same-sex attraction and activity have tended to regard homosexuality as deviance. Medical views of alternate sexual preferences followed suit. In late 19th century, and throughout most of the 20th, psychiatric authorities tried to explain homosexuality within a disease framework. Perversions were illnesses, caused by developmental problems and subject to treatment fashions. Non-evidence-based theories about hormones and cultural biases about masculinity were translated into clinical practice. The cataloging of sexual behavior within the field of medicine did not begin until late 19th century, as Dr. Jack Drescher explains.
The most important historical document in that history was a book called The Psychopathia Sexualis by Richard von Krafft-Ebing, a psychiatrist who did a catalog primarily of case histories and stories that he'd either directly observed or heard stories about of individuals who had unconventional sexual behaviors or unconventional sexual presentations or gender presentations.
In 1896, Havelock Ellis, a British physician, co-authored a textbook in German that was translated into English the following year, Sexual Inversion. Unlike other current works, the book was an objective study of homosexuality, regarding it as neither pathological, immoral, nor criminal. Between 1897 and 1928, Ellis published the 6-volume Studies in the Psychology of Sex, including topics such as autoerotism and transgender psychology. Meanwhile, Sigmund Freud's views on psychopathology, for example, his widely misunderstood theory of infantile sexuality, dominated clinical thinking during the first half of the 20th century.
Freud takes up the subject of homosexuality in his famous 1905 book, 3 Essays on the Theory of Sexuality, where he describes his theory of what causes all kinds of sexual deviations, such as homosexuality, pedophilia, bestiality, by inventing a theory which describes the difference between a sexual object and a sexual aim. And since normal people are supposed to aim their penises into vaginas, anybody who does not, has to have an explanation.
Although Freud appeared to be broad-minded in his approach, by imputing both masculine and feminine aspects to the normal human mind, he was unforgiving about homosexuality, still considered the result of arrested development.
He offered an alternative theory that everybody has homosexual and heterosexual tendencies inside them, what he called bisexuality, and that in the case of adult homosexuals, they were arrested or stunted in their growth, and they continued to express the homosexual side rather than the normal heterosexual side they should grow into as adults.
The field of sexology in America began in the 1940s, not from the psychoanalytic point of view, but from field research about actual sexual attitudes and practices.
And Alfred Kinsey wrote 2 landmark studies. He was one in 1948 about sexuality in men and one in 1953 about sexuality in women. And the purpose of the study was to go out, he did interviews of thousands of people to see not what sex should look like, but what does sex actually look like among people. So it's sort of the difference between psychiatrists and sexologists go out and do field studies. They do research, and then they try and figure out how do you make sense of it.
Mid-20th century psychiatry was frustrated with the failure of psychoanalysis to cure the condition of homosexuality. The general goal of psychiatric treatment was to suppress same-sex tendencies and to restore patients to the normal developmental pathway. The failure of psychiatry to appreciate homosexuality as a normative variant led to radical and even harmful remedies.
There were cases of people being given brain surgery as a way to try and cure their homosexuality. You have those kinds of theories. People did aversive conditioning, either with noxious substances or with electricity in the 1960s. And so the attempt to try and dissuade people from being homosexual by exposing them to a visual image a sexually exciting visual image and then giving them an aversive conditioning so that they would change their, their attractions from one to another.
Classification of mental disorders, beginning with DSM-1 in 1952, did not incorporate findings of sexologists, instead relying on psychoanalytic and traditional views about deviant sexuality. The categorization of homosexuality, for example, as a perversion, perpetuated the myth that it is a disease that must have a cure.
When homosexuality becomes a category of medical illness, then the question becomes well, you have theories about what must cause it. So the treatment reflected the theories. So the theory is in psychoanalysis that something happened to you in your childhood, affected your normal sexual development. So therefore we're going to use psychoanalysis to bring up all the trauma and the memories and get you as an adult to look at what went wrong, and then you can correct it and become a heterosexual.
DSM-2, published in 1968, did little to move psychiatric thought toward acceptance of variability in sexual preference.
DSM gets revised in 1968, the DSM-2, and I think it's moved into the perversions as the category there.
In the 1960s, the free love movement coexisted with the criminalization of homosexuality and anti-sodomy laws. A breaking point came in 1969, when demonstrations at a gay social venue brought unfair treatment of sexual minorities into the spotlight. Dr. Drescher recalls this pivotal moment.
The Stonewall riots served as a kind of springboard that vitalized what became the modern gay rights movement. And when the modern gay rights movement began to organize itself, the first group that they focused on was psychiatry.
Psychiatry, with its antiquated ideas, brutal therapies, and ignorance of naturalistic evidence, became the target of activists. Brave individuals from the mental health professions stepped forward to challenge prevailing psychiatric culture, for example, at APA meetings in the early 1970s. Momentum increased for recognition of sexual preferences as non-pathological states. Activists disrupted meetings at the APA conventions in 1970 and 1971. Luckily, Dr. Judd Marmer, a prominent psychoanalyst, welcomed discussion. By 1972, there were gay affirmative sessions at the APA meetings. One of them was a panel that included Dr. Marmer, gay activists Barbara Giddings and Frank Kameny, and Dr. John Fryer in disguise.
Dr. John Fryer of Philadelphia appeared as Dr. H. Anonymous, Dr. Homosexual Anonymous, and he appeared wearing an oversized tuxedo, a Halloween mask with a fright wig, and used a microphone to disguise his voice.
Against significant resistance from within, the APA commissioned a review of the sexology and medical literatures. The committee's task was to decide whether there was sufficient evidence to remove homosexuality from the DSM.
And after a review of all the literature, the committee decided that the literature from the sex researchers was more scientific than the literature produced by psychoanalysts.
Dr. Marmer continued his advocacy, and during his APA vice presidency in 1973, the Board of Trustees voted to remove homosexuality from the DSM-2. 2 years later, when he was APA president, Dr. Marmer called for equal rights for gay military men. In 1976, Dr. Marmer became a GAP member. Dr. Fryer, meanwhile, became a hero of the gay rights movement. His bravery was commemorated in a historical plaque in Philadelphia, where he was a professor of psychiatry.
In 1974, they held such a referendum. There was 10,000 psychiatrists voted at the time, and 58% voted to support the Board of Trustees. And so homosexuality was officially removed then with the referendum assent.